Dengue is a global epidemic affecting over 140 countries. It is a fatal viral infection that is commonly transmitted through mosquitoes. Our group has been working together to find how we can eliminate or minimize the transmission of dengue.
We know dengue is a fatal disease, but how is it transmitted?
Dengue is transmitted from person to mosquito. Say a person is already infected with dengue. A mosquito then bites the patient and becomes infected.
Infected mosquitoes transmit the virus to each person they bite. The more people they bite, the more people get infected.
But how do we stop this? How do we limit the spread of dengue and fight back from this disease? We are going to find out how we eliminate dengue, especially dengue in Pakistan.
To take steps to eliminate the spread of dengue, we need to understand how dengue originated. We asked infectious disease specialist at John Hunter Hospital in Australia, Dr. Aisha Akram, her point of view on the matter.
There are many theories concerning the origin of dengue. I wanted to ask your personal opinion on this matter. What theory do you agree with?
So look, theories is a different thing, but we have to think about it scientifically. So if we talk about dengue virus, it's a flavivirus. There are many flaviviruses around, and it's from a big family of viruses which is called flaviviridae. So there are some actually records which show a dengue-like illness from some of the records or from some of the archives which were written back, say, more than 200 years ago. So which means that the disease was there, and there is some scientific hypothesis that there is a possibility that this particular flavivirus may would have cross species from the primates, and from the primates it may would have come to humans somewhere between maybe 500 to 1,000 years ago. But again, that's a hypothesis, we can't really prove it. And then once of course it has cross species and it has come into humans, it has become of course very prevalent, more so because of the success of the nature of the Aedes aegypti, which as a mosquito is very successful, I would say, considering the fact that the area where the Aedes aegypti, or the geographical range where the Aedes aegypti is present in the tropics and the subtropics. And then I think a big factor which has led to further success of this particular mosquito and with the more spread of the dengue is because of the global warming, which has definitely played a massive role, because the places where, or the geographical distribution of Aedes aegypti has definitely spread. If we look at the scientific records, the first dengue virus was isolated back in 1943. There were two scientists who were working on patients in Japan, which found or had the virological definite evidence of that virus causing the disease. So from 1943, of course, we have actually come through a long way. But the initial discovery was only on the serotype 1, which happened, and then later it was more so in 1970s when they figured out that there are the other serotypes as well. And but by around around 2004, all the four serotypes were geographically distributed in most of the areas where we see the dengue virus today. But more so, I would say the origin was primates, but the way it has spread, global warming has really played a really massive role in that.
Since the 1600s, dengue has been a deadly disease affecting global health. The success of the spread of dengue virus is predominantly due to the Aedes aegypti mosquito.
This species of mosquitoes is very resilient and commonly found across the globe. It is easily able to carry diseases like dengue virus, and the widespread of dengue is mainly due to this mosquito species.
In countries where there are frequent rainy seasons and the presence of Aedes aegypti mosquitoes, they are at greater risk of the dengue virus, as this species of mosquitoes breed and expand their population more quickly in such regions, increasing the number of mosquitoes with dengue.
In recent years, the more frequent and intense flooding in Pakistan triggered a significantly higher number of dengue virus cases. According to National Institute of Health Islamabad, between January and September 2022, there were over 25,000 cases of dengue, of which 65 were fatal.
Dengue virus has become an epidemic in Pakistan as there are more and more cases being reported each day. And if action is not taken to suppress the transmission of dengue, there can be a large amount of deaths across the nation.
So, what are some reasons, according to you, which have made dengue a deadly disease in countries like Pakistan but not others?
There are many factors which make dengue a deadly disease not actually just in Pakistan, but other places as well. So there are two types of factors. I think they're one of the most important factor is the viral factor per se. There are different serotypes of the virus, and there's one particular serotype, serotype 2. So, the places where serotype 2 is prevalent, we have seen that the mortality is slightly higher in comparison to the other ones. The second biggest factor, especially in Pakistan, is the hyper endemic state. So, what happens is that when a place where there is hyper endemic dengue infection, which means that there are many serotypes which are in circulation. And we know the fact that usually the severe disease or dengue hemorrhagic fever or dengue shock syndrome is more prevalent in people who have the secondary infection. So a person may would have been infected initially with the primary infection, which may be a mild disease, but when they have the secondary infection, that is when they usually have severe disease. There's a phenomena, something called like antibody dependent enhancement, and because it's quite a long time now, it's almost more than 3 decades, the dengue has been quite prevalent and hyper endemic in Pakistan, which means that people are getting infected again and again with different serotypes, which enhances the pathogenesis and enhances that antibody dependent enhancement and the increase in the immune complexes, which makes the secondary infection very deadly and makes it more severe form, which could be the hemorrhagic fever or which could be the shock syndrome, which actually kills the people. But then that's the viral factor. But we look at the other epidemiological factor, especially if we talk about the last year, 2022, because of all the floods and the way there was a lot of population movement, especially in the flood times, which led to enhancement of the vector as well, which means when we have more of the mozzies which are circulating around, they're especially spreading it more. And when there was so much flood, I think the WHO data, if we look at especially from the last year, there were more than 65 or 68 deaths from dengue, especially around the zones time of the April to May when there were lots of floods, which means that people who are affected, they have no way to actually prevent themselves from the dengue virus, from the Aedes aegypti. And then if they are getting infected again and again, that's making it more deadly and more increasing the mortality as well.
As people get infected with dengue, they have no way to fight back the disease apart from their regular immune response. There has been no development in any cures or vaccine against the dengue, which makes it more deadly disease.
The slow development of a cure for dengue is due to the imbalanced immune response that a vaccine with one stereotype may cause.
A serotype is a microorganism, a subspecies of bacteria that can help fight against dengue, but in doing so, imbalances are your regular immune response.
So my question is, every year over 400 million people get affected with dengue, resulting in over 36,000 deaths. Why hasn't a treatment been developed? Is it because of the complex immune response that dengue causes, or what?
Look, it's a very good question actually. That why this why is very important. That why no treatment has definitely been developed. So we know this thing that dengue has been identified as a one of the neglected tropical diseases, and if we look at the efforts which have happened or which have taken place to really find a cure for the neglected tropical diseases, the efforts are really scarce. We don't see much efforts in the face of really serious drug development, which has actually taken place. So that's of course one factor. But the other factor is that if we are looking for a cure or a disease or a drug which will actually be able to reduce the burden of the virus in a patient, especially when we are looking at the severe spectrum of the disease, we're looking at a pan serotype drug. So a drug which should be able to act on all the four serotypes of dengue. And I think that that is the biggest hurdle in development of a safe therapeutic option, which would actually cover all the four serotypes and it can actually cure or reduce the viremia in a patient who is actually having a severe disease. But if we look at some current studies, which are actually or the pipeline of the antivirals, which are in the time of development, specifically for dengue, there are actually two main agents which are currently in development. One is an inhibitor of the viral replication. It is called NS4B, and that's currently in studies, which is actually on in human studies as well now to find a cure. And the second agent, which is a guanosine nucleotide analog inhibitor, it's also in a pipeline, which is under development at the moment. And this one is actually in phase one and phase two trials now to, and this is specifically for prevention and then for cure as well.
Our goal is to limit the transmission of dengue. On an individual level, we can take many steps to eliminate this fatal disease.
We can ensure there is nowhere in our homes mosquitoes can breed. Installing grills on walls to prevent mosquitoes from initially entering our houses.
Try and cover as much skin as possible by wearing pants and long sleeve t-shirts. This reduces the chance of getting bit by mosquitoes.
As a community, we can reduce the spread of dengue too. Communities can get together and clean up their neighborhoods, ensuring drainage and sewage systems are clean to prevent the breeding of mosquitoes.
Some communities have already taken initiative by spraying mosquito repellent spray from the back of trucks to kill mosquitoes in large numbers.
According to you, what are some steps we can take to limit the transmission of dengue as a community in Pakistan?
Look, the transmission is, of course, highly dependent on the vector, the Aedes aegypti. So, if we need to really, at a community basis, want to reduce the transmission, we'll have to look at least three factors. So, I think the first factor in the community is education and reducing the overall transmission through reducing personal protection or through increasing the personal protection. So getting that awareness, getting that education that Aedes aegypti is a daytime biter. It's an urban vector which is around everywhere. So how we can all the education to the public that how we can use the mosquito repellents, how we can use insecticide spraying, how we can use protective clothing to reduce the overall bite, which is, of course, the vector. The second important thing is the vaccine. I think an effective long term vaccine is also very important in reducing the transmission. If we look at what is available at the moment, so there is one vaccine called Dengue, which is CYDTDV, which is a vaccine which has been licensed for use for prevention of dengue. But this current vaccine, which is available at the moment, has been licensed, is only available for people who are seropositive, which means that somebody who had one serotype which infected them and they have seropositive diagnosed, and then we can use this vaccine. But unfortunately, as this vaccine program has been rolled out, there are some problems with the vaccine as well. That if it's used in those who are not seropositive, they may end up having more severe disease, and it's not very effective in very young children as well, which are again the group of people who are associated with increased mortality as well. So that's of course. But I must say that there is another vaccine which is in development at the moment, which would be coming up in future, which could be used even for seronegative people as well. And I think the third and the most important factor in the control is the mosquito control. And mosquito control is not easy. And there have been, I know that massive efforts to reduce, but it's very hard to sustain the reduction in the overall burden of the mozzies. But the most important at the community level, important step is to reducing the breeding sites of the mozzie and in reducing the larva, especially overall breeding site and the larva control as well to reduce the transmission. I'll just add on one thing that there are some places in the world which have actually used very successfully a program which is called in which they release mosquitoes in the community which were infected with a bacteria called Wolbachia. And with the infected mozzies, they actually reduce the transmission of the dengue in the community. So that's another thing which can be looked at in future to implement that strategy.
Pakistan as a nation needs to work together to eliminate this deadly disease by suppressing the transmission of dengue.
Across the world, there are scientists working on ways to suppress dengue. Some companies have started working on a cure for dengue, while other universities have found ways to use bacteria to stop dengue.
Monash University has worked on a bacteria that hinders the transmission of dengue. Wolbachia bacteria has prevented dengue cases in small towns in Queensland since 2014.
Other countries can also use this practice to suppress the spread of dengue.
The transmission of dengue must be stopped. This deadly disease has taken many lives, and to prevent further deaths from the dengue virus, we must take action.